Hello, my name is Laura Garces. I'm going to talk about quadrupling inhaled glucocorticoid dose to avert asthma exacerbation. First definition. Asthma is one of the common chronic diseases with an estimated 300 million people affected worldwide. Acute exacerbations of asthma are threatening for patients, cause considerable illness and death, and account for a large proportion of the overall cost related to asthma.
IL-13 is a pleiotropic cytokine central to the type 2 response. It is produced by activated T cells, NKT cells, basophils, eosinophils, mast cells, innate type 2 cells, and monocytes, and is elevated in a subpopulation of patients with asthma. IL-13 acts by binding to IL-13R alpha 1, causing heterodimerization of the receptor with IL-4R alpha and subsequent signaling. It is this signaling that makes IL-13 an important cytokine central to the type 2 inflammation that contributes to many key features of asthma, including mucus production, airway hyperresponsiveness, fibrosis, and IgE synthesis. IL-13 also plays a key role in reduced glucocorticoid receptor binding affinity and blocking glucocorticoid receptor translocation to the nucleus. IL-13 is elevated in patients with glucocorticoid insensitive asthma, correlates with severity of disease, and can also be elevated in patients that have experienced asthma exacerbations. Therefore, IL-13 blockade is an attractive therapeutic approach for the treatment of bronchial asthma.
Application in medicine. The objective of the treatment of a crisis is to preserve the life of the patient, reversing airflow obstruction and hypoxemia as quickly as possible, and later establish or revise the therapeutic plan to prevent new cases, which included some temporary quadrupling of the dose of inhaled glucocorticoids when asthma control started to deteriorate. Pros and cons. Pros. In case of persistent refractory respiratory failure of symptoms or seen of severe exacerbation is the possibility of using non-invasive mechanical ventilation of referring the patients to the ICU for orotracheal intubation and mechanical ventilation. Cons. We compared a self-management plan that include an increases in the dose of inhaled glucocorticoids by a factor of 4 quadrupling group with the same plan without such an increased non-quadrupling group.
In pediatric asthma management, early signs of loss of asthma control often portend an impending exacerbation. This condition is often referred to as entering the yellow zone. Escalation of asthma treatment in the yellow zone has been considered as a way to prevent full-blown exacerbations, but there's limited evidence to support this approach. This randomized double-blind trial involved 254 children, aged 5 to 11 years, with mild to moderate persistent asthma, who were being treated with daily low-dose inhaled glucocorticoids. When they entered the yellow zone, those in the intervention group increased the dose of inhaled glucocorticoids by a factor of 5 for a week. For those in the control group, the dose remained unchanged. The primary outcome was the rate of asthma exacerbations leading to treatment with systemic glucocorticoids. That rate was not significantly different between the two treatment groups, with 0.37 exacerbations per year reported in the low dose group and 0.48 exacerbations per year in the high dose group. The growth rate in children randomized to high dose inhaled glucocorticoids was 0.23 centimeters per year less than in children randomized to low dose inhaled glucocorticoids. The authors conclude that increasing inhaled glucocorticoid doses five-fold for 7 days at the early signs of loss of asthma control in children with persistent asthma being treated with daily low-dose inhaled glucocorticoid therapy does not significantly reduce exacerbations and may be associated with adverse growth effects in the children. Full trial results are available at nejm.org.
I applied in Ecuador. In the country, there is no a concrete number of how many persons they suffer this respiratory deficiency, but in agreement to the world estimation of which the pathology affects 10%, Ecuador will have a bit more than 1 million affected persons. Conclusion. In this involving adult and adolescents with asthma, a personalized self-management plan that included a temporary quadrupling of the dose of inhaled glucocorticoids when asthma control started to deteriorate resulted in fewer severe asthma exacerbations than a plan in which the dose was not increased.